Hello, everyone. Good morning, good afternoon, or good evening, wherever you are on this little planet. I'm Alex Pashov from Crystal Touch Clinic. We are situated in Rotterdam, the Netherlands. First question which we received is from Julie. Can you please tell us if acupuncture would be helpful for residual synkinesis, i.e., facial relaxation and recovery? Thank you, Julie, for your question. In general, acupuncture, I do have very big respect for acupuncture as a method, because otherwise it would not survive a few thousand years of its history. In particular, for synkinesis, acupuncture, in my opinion, will not render a lot of help, except for that it may be useful, and it is useful for some patients. We have heard it helps to relax facial muscles more than without it. As a directly influencing remedy for synkinesis, I don't think it is the case, because synkinesis have a bit different nature than only facial tension. If you want more details, feel free to read our website. There are some posts about that where I elaborate about the nature of synkinesis in more detail. Next question is from Mary. I suffer from Bell's palsy for 42 years. Is there any remedy for this? I still can't close tightly my right eye, and I suffer from teary eyes. Mary, thank you very much for your question. Well, our approach to rehabilitation of synkinesis and other residuals and complications after facial palsy is that those symptoms are not a result of aberrant regeneration, which is a majority of medical world has that opinion. We have a different opinion, and we think that facial synkinesis and other symptoms that patients after facial palsy suffer is a result of changed mimetic patterns of our brain, the brain that manages our facial movements. That is why it is possible, from our point of view, to improve the condition even after 42 years since Bell's palsy. Actually, at the clinic, we have had a patient who came to us after 62 years since the onset of her facial palsy. She was affected when she was 2.5, and she came to us when after she turned 65. And still, she was able to achieve improvements, and her portrait is in our clinic on our so-called wall of honor. So it is possible, and also teary eye is also very much possible to address. It is not something magical that will happen overnight, but absolute majority of our patients who had suffered from teary eyes, it's called crocodile tears, they have achieved their improvements, and they were pretty satisfied with the results. Next one from Katya. We have several questions. Katya, my eye is getting smaller on the affected side. Is it possible to prevent it somehow, and how to make it bigger again if possible? Your eye is getting smaller because the circular muscle of the eye, the muscle that surrounds the eyeball and occupies the eye socket, is getting a lot of, let's say, background signals from the brain. It's tonal signals, yeah? And due to that, those tonal signals, your eye muscle experiences certain contraction, background contraction all the time. And that is why your eye fissure becomes more narrow and your eye looks smaller. And indeed, during our rehabilitation programs, our patients do achieve improvements of that particular symptom, because the general attitude of their brain, so to say, becomes more matter-of-factly, not as pushy as it is on your affected side now, when a lot of muscles experience tension, when the eye fissure becomes more narrow. In some patients, nasolabial fold looks deeper on the affected side than on the healthy side. Also dimples in the chin. Those are all the symptoms of increased intensity of background contraction signals that are created in the brain, and they are sent all the time, almost constantly, towards the facial muscles. That is why probably you, Katya, and also other our visitors today experience extra tension of the face during the day, even if they don't move their face, even if it's a presumed neutral expression. Another question from Katya. Is it okay to use fillers into the nasolabial fold to hide a contracture to make face look more symmetrical? If yes, what filler is more secure with this condition? Well, Katya, to start with, you are still young. You are 20, I think, out of my head, 25, 26 years old. So in any case, to use fillers at your very young age, I think it's a little too early anyway. And the filler may, if you do that, may cosmetically fill in the nasolabial fold, but that nasolabial fold is created, as I just said, by a excessive tension of the muscles, and that extensive tension will not go away if you use the filler. So it will be well, temporary, because nowadays they don't use permanent fillers anymore. So with the time, the filler will dissolve, and you will have the same initial situation as you had it before. And unless you address the core cause of that particular symptom that you are trying to improve, then it will be just there all the time, and well, will not get much further. But again, you will be with us next week in the clinic, so we can talk about this in more detail, and you can ask more of your questions, and I can give you a more detailed explanation if you want. Next question, last question from Katya. What do you think about the upper blepharoplasty surgery to make the eyelids look more identical? I'm afraid that it might be harder to close the eye or blink after it. Again, Katya, at your very young and strong age, it is not appropriate, in my opinion, from my point of view, to go for blepharoplasty, because, again, as I said, the smaller eye fissure is not due to some organic reasons which have to be corrected by surgical intervention, but by the pure reason that your circular muscle of the eye, musculus orbicularis oculi, receives additional contraction signals from the brain. And as long or as soon as you will start learning to maintain the background relaxation of your facial muscles by first consciously and then habitually keeping your face in a relaxed state, we have all reasons to believe that that problem will become less urgent, and you will not be as eager to fix it quickly. And in any case, we need to realize that whenever the surgeon's knife enters your body, that's one way. Whatever the result may be, good or bad, with or without side effects, it is a one-way street. You cannot make it undone. Next question from Angie. After 11 months since my Bell's palsy, I started seeing a chiropractor who was working on my neck. Initially, I saw many improvements, but after a year, I stopped seeing changes. Now my face is very tight, and I have synkinesis. Did I make a correct choice by going to chiropractor? Is there anything else I can do here in US to improve my condition? Angie, thank you very much for your question. It is a good question, and I think that if your chiropractor knows what he or she is doing, it is always good to attend those sessions. In any case, it is good for your general health, for the mobility of your joints, and also for background or basic relaxation of your body and your face in particular. So I don't think you did anything wrong. And synkinesis is the symptom that practically in all cases will develop if the recovery after facial palsy follows one of the two scenarios, the long scenario. If you take some time and read our website, you will find the post where we speak about two possible scenarios of recovery. One is a quick one, when the damage to the facial nerve was only superficial. In those cases, the recovery comes full return of facial movements comes within 2 to 4 weeks, and then it's without any residuals, complications, completely recovered, turn the page, carry on. But if the damage to the facial nerve was more severe, then the degeneration of nerve fibers will take place, and then with regeneration comes slow recovery, and it can take anything from 5 to 10 weeks, or even longer sometimes in very heavy situations, until the person starts to see certain return of facial movements. And in those cases, certain degree of residuals and complications in the form of synkinesis, or increased background contraction level of the facial muscles is very hard to avoid. You can work on that later on, of course, but it was something that was to be expected. That is why I don't think you should be regretting your visits to chiropractor. As far in the US is concerned, well, we are actually the only clinic that performs this particular rehabilitation method, neuroproprioceptive rehabilitation, facial rehabilitation. In the US, there are other specialists, but as far as I know, most, if not all of them, suggesting either surgical intervention, like Facial Paralysis Institute in California, or they use in one or the other way injections of Botox, which we do not use, and actually we do not recommend. I don't say that somebody is wrong, and I'm not trying to say only our approach is the right one. I'm just sharing with you our opinion and our point of view. I will be speaking about Botox in the next question, if I remember, because our next question is from Margie. I have had Bell's palsy for over a year now, and I have some lasting damage to my eye and mouth. I saw some improvements after your last Q&A session, which was, I believe, in February this year. It's my remark. When you advised to do regular massages, I continue doing them. My neurologist suggested that I do Botox. What is your thought on that? Thank you, Margie. We are now in extensive correspondence with you. You have sent us your history, also the pictures of your face, and we will do a follow-up of this correspondence later on next week, because after this session will be weekend, and then so we'll communicate further on your particular case next week. So question about Botox. Of course, this is the Botox is the modality. This is recommended by most of the specialists after it has been established that synkinesis and contractures or increased excessive level of muscle tension has developed. We need to realize that Botox is a commercial name for botulinum toxin, which is essentially a poison, which in its action blocks the transmission of the contraction signal from the nerve to the muscle. So to say, if this is the nerve ending and this is the muscle fiber, so the botulinum toxin blocks this part of this is called neuromuscular junction, and the signal cannot jump over from nerve to the muscle. This is an irreversible situation. So that part of the nerve ending dies, and the nerve fiber starts to grow side terminal to reconnect to the muscle that is deprived from signals coming from the brain. That is why it takes some time, of course. That is why the effect of botulinum toxin injection is not permanent. It takes from 2.5 to 4.5, 5 months before the effect of botulinum toxin disappears. Well, I don't say it doesn't help. It does help. We have to realize, however, that it is a symptomatic measure. This is and if you go for it, it's totally your decision, up to you to decide. You will need to repeat it, well, endlessly after every 3 months, 4 months, whichever time your body will take to recover the damage made by the botulinum toxin to your nerve ending. So that is the question about that. So as you can gather from what I have just said, we do not recommend it because that modality does not address the underlying core of the problem, which is in the functioning of the newly formed mimetic patterns. Another question of Margie. Also, my balance has never returned, and I use a walker all the time because I'm afraid of falling. I also lost hearing on the affected side a few months after the onset. None of the doctors have seen seem to know what to do for me. I am 77. Thank you again for this question, Margie. I realize that you are a very grown-up person. You are 77 years old, so of course regenerative capacity of your body is lower. Considering that you said that your balance was disturbed and you lost the hearing, from this I indirectly can conclude that the inflammation in this area, in the let's say in the initial part of the onset, was pretty severe, and it most likely was caused by the viral infection in the form of herpes virus. In a lot of cases, when herpetic infection is there, a patient may experience painful sensations, sometimes moderate, sometimes low, sometimes very heavy intensity, and it is an indication that the effect of that inflammation caused by viral infection is very heavy. And if that infection is extensive, then also the hearing device, so to say, our hearing device inside the ear, the artificial one, the real one, can be the cochlea, it's called, can be affected, or otherwise the hearing nerve can also be involved in the process of infection and inflammation, and it can also suffer some damage. And in those cases, hearing and balance can be disturbed or disrupted, because that hearing nerve, which is, by the way, runs pretty close to the facial nerve, they provide signaling to our balance sensation and also to our hearing. If it's for Margie, if we want to discuss this in more detail, then we probably have to go for a video session, video consultation, so we have more time to discuss your particular situation. And if you don't mind, I will carry on with the other questions. Olga is asking, what must I do if I see no improvements for almost a year now? I have synkinesis, some tight muscles, and well as my cheek still looks a bit swollen. Thank you, Olga, for your detailed question, because you're really asking a lot of 1, 2, 3, 4 questions, several. Well, if I am reading what you are writing, you say I see no improvements. Probably it is not entirely correct, because in the acute phase you had no movements at all, so your eye was wide open, nothing would move, your mouth corner would droop, it would be probably losing some liquids and food when you were eating or drinking through the mouth corner. Now it is exactly the opposite. Now your affected side is much tighter than your healthy side, and that's why you also have synkinesis and tightness of your facial muscles, because of those symptoms and because of those reasons which I have just explained in the beginning of this session. And your cheek looks a bit more swollen, or a bit swollen than on the healthy side. It's probably because your muscles are not contracting and relaxing as intensely as the muscles on the affected side. Because as you probably know, our lymphatic system has no engine. The blood vessels have their engine, our heart, but the lymphatic system does not. And the only way to propel the liquid through the lymphatic vessels is contractions and relaxations of the muscle. That's why when we sit for a long time in the plane, for example, or in the train or in the car, then we step out, our legs could be swollen because our muscles do not contract and relax, so they don't propel liquids through the lymphatic system, and that is why it stays there. I would say that could be the reason. And if you want to reduce that swelling, don't hesitate to touch your face with your hands. Go to a beautician, or if you can do it yourself, some gentle massage of your face, always symmetrical, from the midline outward and from lower part upward. Yeah, so this way. Or of course you can do it also with your fingertips, gently working with circular movements on your muscles one by one. Of course, for that please feel free to download the facial muscles from internet or from our website. There is somewhere a picture that shows how the facial muscles are present in our face, and you can use that. Ruth is asking, I had Bell's palsy since December 2021. I did recover fully. I have facial tightness and uncoordinated facial expressions. I still have numbness, mild pain, and ringing in my ears. I have been doing daily facial massage but stopped exercising because I heard that was bad for the tightness and could make the muscle tightening worse. In my area, the doctors only advise exercising, physical therapy, acupuncture, etc., but it all does nothing. Ruth, thank you very much for a detailed explanation or description of your situation. You refer to uncoordinated facial expressions. Indeed, on the later stages of recovery, when the recovery follows the second scenario, which I've just mentioned a few minutes ago, indeed, the coordination, so-called reciprocal inhibition between agonist and antagonist muscles becomes disrupted. And because of that, you have massive contractions of muscles all at the same time, because normally when everything is working properly, like both in our face and also in our arms, legs, and hands and everything, when the agonist muscle contracts, for example, biceps contracts, I flex my arm. In the same time, triceps relaxes in order not to prevent the movement that I have initiated. When I extend my arm, triceps contracts, biceps automatically relaxes to provide proper and smooth execution of a movement. The same story goes for the face. But during the long recovery period, as I mentioned, the mimetic patterns of the face, as far as the brain management is concerned, have been changed, because for a long time the brain could not manage or could not move your facial muscles in a expected manner. So it has changed the patterns. More detailed, we can discuss it with you if sorry, if you would like to register for online consultation. Then we can discuss your situation more in particular as far as your personal case is concerned. Also, Ruth has asked a couple of particular questions. Will the ringing in my ears ever stop? Well, the ringing in the ear is related to a very tiny muscle. It's about 3 millimeters long, the smallest muscle in our body, and it's called musculus stapedius, and it makes part of our hearing organ. And when that muscle is contracted or super extensively relaxed, then the eardrum is either very tight or very loose. In that case, because of constant deformation of the eardrum, you don't hear this. There is no sound. There is nothing that creates this sound. It is kind of parasitic signals that are being created in your hearing organ due to constant deformation of the eardrum due to the condition of that particular little muscle. Sometimes when the patient may develop this kind of synkinesis, so when he or she blinks the eyes or puckers the lip, you hear a clicking sound in your ear. It is also because, due to the same mechanism as other synkinesis, for example, blinking or closing the eye fissure when you pucker your lips, that muscle little bit contracts and creates sort of feeling of non-existent sound, but you experience it in real time. Will my face straighten out over the time on its own? Well, not likely that it will straighten out on its own. Why? Because, as I just said, it is a habit. It's the same, very similar to the handwriting. If you don't work on your handwriting will is likely to remain exactly the same until the rest of your life. So even when you write a letter to your mother, to your brother, to anyone from your family who knows you, they will recognize that it's from you, not even having to look at the signature, because the handwriting is a habit that your brain has developed when you were learning to write at school, and later on in the course of your years, until it has formed into a constant handwriting. So that is the reason why we think this is what we experience also. You remember I mentioned 62 years since the Bell's palsy and still synkinesis persisted. We have a lot of patients who have not only come to us after 6 months, 8 months, 9 months, but a lot of patients want to address their problems related to the face after 10 years, 15 years, 20 years. And so far, we have been able to achieve together with them. We don't do miracles. We work together with patients. It's always a cooperation, a joint venture, so to say. We have been able to achieve improvements with absolute majority of those. There are a few who have not, but those were mostly due to specific features of their psycho-emotional structure, so to say, and their attitudes towards themselves and towards their rehabilitation process. And the third question from Ruth: is there any bona fide therapy that does work to help cure these residual symptoms? I would say that the word cure here is not really applicable because you are not sick. You are having to do with the complications, same like limping after a broken bone on the leg, for example. Yeah, so it's limping is not a disease. It is a result, a consequence of a broken leg, which is, yeah. And the same comes with the residual the complications after facial palsy. Don't make mistake, you are not sick anymore. You are just having to do with residuals and complications. That is something that you have to be prepared to be actively busy with your rehabilitation process. So, well, bona fide therapy, I wouldn't say that our therapy is bona fide, but this is what we do. And again, I'm not trying to say that somebody is doing it wrong or somebody is doing it right or we are any better than others. It is up to you to learn what you do and how we do it and what you don't do, also important, and make up your mind what you would like to apply in your particular situation. Tanya is asking, is it possible to have my smile back after 3 years of Bell's palsy? I have just answered that question a few minutes later, but again, Tanya, please realize that you don't have Bell's palsy anymore. Bell's palsy was finished in the period when you started to see first movements returning back. Then paralysis, palsy is a paralysis. You don't have paralysis anymore, I believe. But you do have residuals and complications in the form of synkinesis, hypertone, and probably others. Maybe some painful sensations, could be sometimes tender or painful spots here just above the eyebrow, around the cheekbone, lower edge of the lower jaw, and so on. So that is something which are the symptoms, the consequences. Yes, and it is possible to work on that, absolutely. It will not happen overnight because I realize that patients, in absolute majority of cases, have developed facial palsy within a few hours or overnight. And subjectively, you would expect that, well, it happened quickly, it should come back quickly, like switch off and switch on the light. Well, based on our experience, it's not the case. It's an injury that part of your body has sustained. If somebody, God forbid, breaks a leg, we don't expect that tomorrow he or she will be able to run and play football again, because the body needs the time to consolidate the bone, to recover its condition, to retrain the muscles back into the normally functioning condition, and so on and so on and so on. So it is a process. Yeah. So that's something that I would like to emphasize. Julie, I recently saw a documentary on some new research conducted by Johns Hopkins University in the USA regarding psychedelic therapy in the treatment of multitude of problems such as alcoholism, depression, post-traumatic stress disorder, and brain-related damage and deterioration. The research discovered that this new therapy actually regrows the branches of the brain that have been damaged and disconnected from each other. Do you think that this therapy could in the future be useful in the retraining of the brain in relation to recovery from long-term Bell's palsy synkinesis? Thank you very much, Julie, for your deep research of that matter. I know that Bell's palsy, or the more correct name of this disorder would be peripheral facial paralysis, because Bell's palsy is just one of the diagnoses that characterize or that name peripheral facial paralysis. There is no brain damage with the peripheral facial paralysis, because what becomes damaged is just one nerve of the whole body. It's the facial nerve, which is peripheral nerve, and brain damage is central nervous system. So, and that's good part for all of the Bell's palsy long-term patients, because the brain is intact. That's a statement. Yeah, Bell's palsy does not cause damage to the brain. So your brain remains intact. The fact that it develops different manner to manage your muscles is the same like your guide. For example, if you with a pen, if your pen is 2 kilos heavy, you can still write. But if you write with that pen for 3 years, then your handwriting will change because your pen is heavy. And then when you take a normal pen back again, then probably your handwriting will not change immediately, if at all, because your brain has developed a new manner of moving your hand and your fingers based on the weight of the tool that you were using to write. That is why I think that that particular method could be very helpful for patients with alcoholism, depression, PTSD, and so on. But for fighting synkinesis, my opinion, I'm not an expert in that one. Don't make me wrong. Don't get me wrong. In my opinion, application to the facial palsy is not likely to be extremely efficient. But time will tell whether it will work, yes or no. Anita, after having Bell's palsy for many years, what is the procedure to get back some movement? Well, it is a rather general question, Anita. Thank you very much for it. Again, it is difficult from your short description to exactly tell whether you have no movements or you experience the, as we mentioned, residuals and complications, which are synkinesis, tightness of facial muscles, and so on. From this short description, it is difficult to tell exactly what your situation is. So if you have no movement, it's totally different story than if you have synkinesis and tightness. So that's why please feel free to contact me directly. The link to that online diagnostic session registration is in the description of this session, so you can see it somewhere on your screen. So please feel free, Anita. I would like to give you an answer, but it's insufficient information at this moment to give it. Diandra, why does my affected side react to cold weather so severely? What can I do to help the ache? Well, the affected side, the quality of the facial nerve fibers after the recovery is different. And that is why it is also a very common situation when the patient, after long-standing, not fully recovered facial palsy, is very sensitive to cold. It is this. My speculation is this, because the brain reacts over intensely to anything that happens to the affected side, whether it be facial movements or it be let's say reflexive contraction of the muscles as response to cold. The brain tends to over amplify anything that has to do with facial movements or contraction of the facial muscles, and much less eagerly the brain would relax or release the tension. That is what you can do to help. As I mentioned, touch your face, do massages, gentle, don't do it hard. And also, if you go to the beautician or the massage specialist, ask him or her not to use, so to say, athletic massage. And the general idea is that massage movements should give you calmness, relaxation, be pleasant, and restore to a certain extent the feeling of unity between your affected and healthy side. So just to reinstate your feeling of oneness of your face. Uma is asking, I'm suffering for 36 years. Can I get relief with your therapy? What can I do? I believe if Uma, thank you for your question, of course, that if your recovery pattern is what I've described during earlier stages of this session, is, so to say, more or less follows regular pattern of recovery with synkinesis, tightness, and everything, again, it is, from my point of view, possible to improve. What can you do? The best thing to do is to make contact with us, and most probably the best way in order for us to get a better understanding of your situation is to register for online rehabilitation, not rehabilitation, I'm sorry, for online diagnostic session, so we can take a look together with you, discuss your questions, and I can assess also your facial condition. I'll probably ask you for, not probably, I will ask you for certain pictures of a number of facial expressions to see how your face is working, and then we can take it from there. Stanislav, I have Bell's palsy for 2.5 years, and there are very strong residual effects. There is no recovery dynamics at all right now. Is there any hope for recovery according to your method? Stanislav, if you have been with us since beginning of this session, you probably already heard my answers to similar questions. After approximately 1 year, the development of residual, so to say, residual effects, or what I call them complications, reaches a kind of equilibrium, so balance. So up to approximately for 9 months to one year, 13 months. By that time post, the facial condition reaches saturation point, and it is not likely to change in any direction, in the better or worse direction, for quite a long period of time. So at this moment, it is was to be expected that there will be, after 2.5 years, no more changes, because, as I said, it's a habit, and your brain has reached certain balance in moving from his point of view, your face, and there is hope and expectation for improvement of your condition. I don't want to promise you 100% recovery, because of course it is something what absolute majority, practically every patient, is dreaming of, but it is in theory possible to achieve, but in practice it will take absolutely disproportionate amount of time to achieve 100% recovery. I mean, years of consistent work, and of course nobody is prepared to do that, but achieving improvements, it is absolutely possible, provided that you are prepared to work and that you are committed to achieve improvements. Wendy, is there anyone in Canada offering your method of treatment? No, Wendy. We are in Holland and we don't have branches, we don't have partners which practice our method. So if you would like to join a rehabilitation program with us, well, feel free to contact us and we take it from there. Farhat, how can synkinesis be improved? It is a question that requires several months, if close to a year, to achieve improvements. As I mentioned, Farhat, it is a habit, and to change any habit that has already been formed, you need time, persistence, perseverance, regularity, commitment, and you name it all. And synkinesis can be improved by changing what is called dominant focus of attention of your brain. At this moment, your brain, if you are the one who is affected, or the brain of someone dear to you, if you are asking for someone else, is mainly, as far as the affected side is concerned, is just mainly main accent is on go, push. We need to change that, because that is exactly the opposite of what we need. Because the harder you push, the more muscles, not you but your brain, the more muscles are involved, and the more unrelated facial muscle contractions you will have. So it's a very vast question which I cannot answer in just a few phrases, Farhad. I hope you understand. Anita, what is your suggestion for people like me who have had Palsy for 4 years? Do we have hope in having some type of normal face? Well, Anita, I understand your frustration about the case. And as I said, absolutely, yes, it is possible to improve your face? Well, depending what you name by normal face, if you relate to your face as it used to be 4 years ago, then it's not likely to happen because you are, first of all, 4 years further in your life. So then your body is 4 years different from what it used to be 4 years ago. Then, of course, your face, even without facial palsy, would be different now than it used to be 4 years ago. Suggestion for people like me who have had Bell's palsy for over 4 years. General suggestion is do not force your face into facial expressions. As I mentioned a few minutes ago, most of the cases, it is not a matter of power of your facial muscles. It is rather a matter of balance in their activation, contraction, and relaxation. And that is something that comes from the brain. So spend some time listening to your face every day. Important, every day, then you build up slowly. Spend some time listening to your face, trying to relax consciously your face one by one, muscles by muscles, going down from the frontal muscle, going to the eye muscle, mid-face muscle, muscles around the mouth, and neck muscles, and so on. Spend a few minutes every day, 5-10 minutes maybe. Then slowly, you will probably notice that your general tension of your face will reduce. Also, doing self-massage, you touching with your own hands, your face. Actually, your hands is the best rehabilitation instrument that will ever be invented. This is my opinion, or our opinion in the clinic for that matter. And don't hesitate to touch your face, to explore it, to listen to it. And if, let's say, do it yourself, it's very difficult to give that recommendation, especially during this short session when we have a lot of questions to be answered. But that's general what I can suggest to you. Don't push your face. Try to refrain from making hard facial movements like making faces in front of the mirror. That's our perception. This is our point of view, that you shouldn't be doing that, because otherwise it may even increase the level of unwanted contractions of your facial muscles. Niley. I had Bell's palsy in April. I started feeling better in May, but then started having problems again. That side feels tense, and when I smile, the inner corner of my eye moves. It bothers me so much. Is this synkinesis? Niley, I think it is the April. We have now October, May, June, July, August, September. We are at 6 months now. So it is indeed the regular course of starting formation of complications after facial palsy. So if your question is whether it is synkinesis, it is not only synkinesis probably, but also the increased tone of your facial muscles and certain disruption in the balance of contraction and relaxation of your facial muscles during facial movements. Is there any exercise, Anand? Is there any exercise, massage to reduce crocodile tears that I can do myself? 1.5 years of Ramsay Hunt syndrome. Thank you, Anand, for your question. Good questions. We do not have specific exercise that is only aimed at reducing crocodile tears. We do know that our patients during the rehabilitation program that we have in the clinic, or sometimes we also do it online for those who cannot come to the clinic, people do experience reduction of crocodile tears, and they do experience improvement, of course, as I mentioned, also with other symptoms that they have been experiencing. So it is, yes, possible. Damian, can synkinesis be reversed after having it for 5 years? Damian, thank you for your question. As if you have heard my answers to previous questions, then you will probably already concluded that the answer would be yes. To let synkinesis disappear completely is a very challenging task, the same as to change your handwriting completely and to make it automatically totally different than that you used to have. It is also a very challenging task, but it can be reduced. Synkinesis, intensity of synkinesis can be reduced. In a lot of cases, can be reduced substantially. There are several factors that can influence that intensity of reduction, but in general question, yes, it is possible, Damian. Ed, I also have synkinesis. BP started on left side of face in mid-January and now about 80% recovered after 9 months. Good. My synkinesis is my left eye. My synkinesis is my left eye tears up when I eat. Any recommendations on how to fix? Ed, I have just answered the question of our previous attendee about synkinesis. Indeed, synkinesis, crocodile tears, which are exactly what you describe when you eat, the eye starts to water. There is a little, there is an explanation from my point of view to that. Here in the corner of the eye, there is a little tear sac where tear, which is produced by tear gland, which is, by the way, also innervated by facial nerve. It is here. So the tears are being produced and collected in the little tear sac, and the tear sac is closed by a little round muscle, sphincter. And that muscle is also innervated by the facial nerve. So what happens, this is also kind of synkinesis. So when you move your, when you eat, when you move your muscles around your mouth, it's my speculation, yeah? I cannot prove it yet. Maybe I will one day, or someone else will. That little muscle starts to uncontrollably open and close, and by that, it would release disproportionate amount of tears to the from that tear sac, and that then your eye would tear. That is a recommendation how to fix. The same as I did general recommendation, try not to force your face. Try to practice relaxation, and when you eat, try to do it without forceful movements of your face, but try to do it matter of factly, as it goes, as it comes. Any forceful movements may exaggerate the involuntary contractions of other facial muscles. Anita, my eye also tears when I eat. I drool at night if I sleep on my affected side. What can I do? Well, about tears, I just said. In your question, Anita, it's difficult to tell why, not why, sorry, how old is your facial palsy. It is, if you drool at night, well, sometimes children also drool when they sleep. Yeah, it doesn't mean that there is any pathology. Maybe your affected side relaxes when you sleep more, or when you dream, your affected side experiences much higher level of relaxation, or lower level of background tension, which is called tone. The same as children. Even a normal, healthy subject, we are all normal, by the way, but a healthy subject who has never had facial palsy may drool. I also, once in a year, once in 2 years, can wake up with some saliva on my chin after a good sleep. So I don't think it is should be considered as something really terrible. But again, if you contact with us directly and we have a session with you via video, via Zoom we work, then I can maybe have a better insight in your particular situation, can see your face in movement, can see your pictures, can have your history in more details. Then maybe we can think about this, or maybe some other particular symptoms that bother you, so we can find the way to address them together. Damian and Ed are asking question: is mime therapy or neuromuscular training helpful for synkinesis and for the control of unwanted contractions of the muscles, especially in the eye muscles? And Ed is asking, are there other treatments or methods that help with synkinesis? Neuromuscular training and mime therapy. Well, I find it a bit difficult to give evaluation of the methods that other specialists are offering to the facial palsy patients. I have no doubt that those who are practicing mime therapy for the patients, or the neuromuscular retraining, have absolutely the intention to help their patients. What I can tell is that in our approach, we do not use elements of mime therapy or facial gymnastics, as it's sometimes called in some countries. We do not do that because we think that forceful movements of the face are not helping to overcome the synkinesis. As far as I know, neuromuscular retraining in some cases, I'm not in detail aware of that, but I believe it contains injection of Botox before the person starts doing exercises of which are not similar, but a bit like exercise of facial gymnastics. We do not use Botox, as you probably heard if you started to listen to this session from the beginning. We do not use Botox for a simple reason that it is a symptomatic measure, symptomatic modality that does not address the core underlying issue that the patient is having. And we believe that we do address that one. But of course, it is up to our patients to evaluate whether what we are doing based on their results is helping them, yes or no. Veronica is asking, in synkinesis, is the nerve damaged? No. Synkinesis, as I said, is a result of new mimetic habits in our perception of this issue. Again, I don't say that someone is wrong or right. I'm sharing with you our view on the whole issue. In most cases, when patients come to us, we do the nerve conduction study. We always do, by the way. We start with nerve conduction study and synkinetic correlation test. These are two instrumental methods, that one of which is fully developed in our clinic. Another one we have for the nerve conduction study. We use a much more extended protocol than it's normally recommended by the neurological standards. And we always do that with the very first working session in the clinic. And in absolute majority of cases, if not all of them, we see that the level of recovery of the nerve, of the damaged nerve, is very high, like 75, 80%, and still the person has synkinesis. And that is an indirect confirmation of what I'm saying, the statement that the synkinesis do not depend that much on the percentage of recovery of the nerve. Actually, synkinesis only start to manifest themselves on more or less after 50% of the nerve capacity has been restored. This is our observation. Okay, somebody who is called Test. He didn't put his name. If I get pregnant, probably you are female. If I get pregnant, how can I avoid additional paralysis? I have the problem on the left side from December 2021, 38 years old. I don't think that the pregnancy by itself can exacerbate or can make your symptoms heavier. Pregnancy by itself is a great thing. You bring new life to this earth, new citizen to this world. So I think it's a really good thing, to bring to this world a new life. And I don't think that you are run a risk to have additional paralysis. I do know that pregnant women in the last weeks of their pregnancy are a risk group. It is indeed the case, but it does not mean that every time somebody gets pregnant, she will get a facial paralysis. Absolutely not. So that's why if you want to get pregnant, by all means, if you and your partner decide to bring a new life to this world, only congratulate you with that decision. Deborah, my concern is in relieving contractures that have appeared 4 months after Bell's palsy onset. What can I do? Thank you, Deborah, for this question. Contracture is not exactly, from my point of view, a correct name of what you are describing. Hypertension, yes. Contracture, I mean, the medical term is something different. Is irreversible changes in the facial muscles, not facial, in the muscle structure that lead to irreversible changes in the function of that particular muscle. From our observation, it is not the case. So higher background tension, which is tone, as I mentioned again, listen to your face, but don't do it hastily. By the way, to all of you who are listening to this transmission, when you work on your face, don't do it when you sit and watch television. Reserve special time for it. Leave your mobile phone somewhere else in the other room. Tell everybody at home that you are not to be disturbed for at least 10-15 minutes, and just remain only one-on-one, you and your face. So listen to your face, focus on what your face is trying to tell you. Your face always has a message. It's a challenge to hear that message. Some of your muscles may be more tense, some of them more relaxed. Should be some imbalance in your facial movements. Listen to it, try to rebalance it, try to relax your facial muscles to such an extent that you will feel your face in equilibrium, in balance, and you will experience your face as one whole instead of one good side and one bad side. Prasanna. I went through a left ear stapedectomy surgery in 2019, and within 1 week of my surgery, I developed Bell's palsy. Presently, I'm 90% recovered, but now when I smile my affected side, I become small. Thank you, Prasanna. I believe we have been in touch with you sometime because the name comes familiar to me, but of course, there is not only one Prasanna in this world. I may be wrong. Most probably, your facial palsy was a result of post-surgical swelling, because if you had a stapedectomy, which so the surgical intervention was in this area where the facial nerve is running on his way to the face. So probably you had compression of the facial nerve by the swollen tissue, and that has resulted in facial palsy. 90% recovered, great recovery. When I smile, my affected side becomes small. Actually, there is no question here. There is just a statement, but I believe you asked why. When your eye fissure narrows, when you move your muscles around the mouth, this is called oral ocular synkinesis. This is a symptom that you describe is synkinesis. Jack, I've heard that once new nerves have sprouted to new areas causing synkinesis, this cannot be reversed. Is this true? Well, only he knows what is true. We think it is not the case. Although, as I mentioned earlier during this session, the prevailing opinion about the cause for synkinesis is its aberrant regeneration or miswiring or whatever it may be called, because the wrong fibers reconnect to the wrong muscles. We are of a totally different opinion. There are a lot of reasons for that opinion that we have it. And the main is that if it were the case, then every time, every result of that miswiring would be different, because it's sporadic. Yeah, it's random. But in each and every case, the manifestations of complications after Bell's palsy is exactly the same: ocular oral synkinesis, oral ocular synkinesis, smaller eye fissure, deeper nasolabial fold, dimples in the chin, quite often inability to lift the eyebrow, and so on, and imbalance in facial movements. So it is exactly the same, and it could be predicted quite precisely, not the intensity, but the nature of complications. That gives us a direct reason to conclude that this is not a random process, which aberrant regeneration is a random process. Deborah, I have developed Bell's palsy on June 5, 2022. Took 6 weeks to recover movements. Will contractures continue to improve, or do I need to implement another treatment to stop contracture from becoming permanent? Thank you, Deborah. June, July, August, September, October. You are now at 4+ and the 5th month of your disorder. Will contractures continue? From what you say, I conclude that you started to feel that your muscles on the affected side start to develop some excessive tension compared to your healthy side. Do my contractures continue to improve? Your facial movements are likely to get better and stronger movements. So the ability of your muscles to contract, because the connection between your muscles, between your brain and your muscles gets better as the time goes. But if you have started to develop those complications which I mentioned, hypertone, extra tension, synkinetic contractions of your facial muscles, those are not likely to disappear by themselves. As I mentioned earlier in this during this session, and recommendations if you want to do it on your own, okay, your choice. Maintain relaxation of your facial muscles as often as you can. In any case, when you are not in conversation with someone, when you are, let's say, one-on-one with your, when you are on your own, waiting for the lift, sitting behind the computer, writing a letter, or doing anything else, try to pay attention that you maintain your face maximally consciously relaxed. Of course, again, massages, especially self massages, help very much. So that is the general recommendation. If you want more detailed analysis of your situation, or later on when it becomes evident that your improvements have reached the saturation point, or when you see that your condition has reached a certain plateau, then please feel free to contact us and we take it from there and we can take a look how we can help you. Deborah, again, second question. I have had palsy 4 times. This is the first time there has been significant pain. I'm using your massage and mind therapy techniques as discussed on your website. Is pain normal? Well, depends where your pain is. If you are at the early stage, but I mean, if you are, if you mean by that your Bell's palsy of 5th June, then you are at your 5th month. And if the pain is not in or behind your ear, but in your face, then it is also one of the symptoms of however controversial it may sound, it is a symptom of recovering condition of your facial nerve. On the other hand, the pain, if you feel it in the face, where I mentioned, sometimes is here, just above the eyebrow, here in this area, here quite often. This is the result of what I call micro cramps. Some of the fibers of your facial muscles may be receiving, let's say, cramp-like continuous signals, like from the brain, like go, 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 and then they will cramp. Not the whole muscle, but certain fibers of that muscle can cramp, and that is painful also by itself and also by touch. Again, as you would do by any cramp, if, for example, your leg cramps or your hand cramps, you would just massage it, make it warm, and so on. That is what I can website. IPEC, last question. Should I expect additional synkinesis after observing crocodile tears? Well, these two symptoms are not related to each other, because the synkinesis with crocodile tears is also one of the symptoms. Not necessarily that the fact of having crocodile tears will also cause synkinesis, other synkinesis. And again, IPEC, it's a bit short question, so I don't know at which stage you are, at the early stage. So because sometimes excessive tearing happens also in the acute phase of the facial palsy. Because, as I said, tear gland is also innervated by the facial nerve. So if there are any irregularities in the function of that nerve, tear gland may produce excessive tears, or that little tear sac, which I also mentioned earlier today, is okay. I see that IPEC that you're saying 4 months. Yeah, at the 4 months time, usually it is the period when the synkinesis start to form. They may start to form a little earlier, but usually between 4 and 6 months, as the facial movements become better and better and better and better, synkinesis start to form. Again, general recommendation, as I already given to several patients today who have asked their questions: maintain your relaxation. Try to avoid your brain, so to say, from developing a habit of pushing your muscles all the time in excessive in an excessive intensity, because that shouting to the muscle, so to say, by your brain is, from our point of view, is a main result of the forming synkinesis. I thank you very much for your attendance, for your commitment to your improvements, because otherwise you would not be you would not have joined this session today. If once again, if you want your situation to be analyzed in more detail, and if you need us to assess your prospects for recovery, prospects for improvements, and so on, please feel free to contact us. And I wish you all good health, good recovery, and of course, stay happy. Thank you very much. Bye-bye, everyone.